Please may you briefly introduce yourself and explain your involvement in the contract negotiations.
Absolutely. My name is Jeeves Wijesuriya. I'm Deputy Chair of North Thames, which is of London, and I'm also on the negotiating team this year on the junior doctor contract.
Firstly, obviously we're here at the nursing demonstration. Why do you think it's important for junior doctors and medical students to support nurses and be here at the demonstration?
Well, I think firstly, it's important to say that what's happening in terms of the bursary is unacceptable. I think it's ridiculous that nurses can be racking up 50 grand worth of debts to on 21k. I think that it's a real shame that we are discouraging people from entering a profession that we nationally have such a huge shortage of. We are desperately trying to find more nurses that work hard and work very difficult hours. And I think what's really appalling is that by taking away that bursary, we stop access to that profession. We reduce the drive to recruitment regardless of what's being alleged. And actually, I think we're also reducing our ability to widen participation, helping people get into nursing.
With the junior doctor contracts going on as well, what do you think this is going to do to workforce morale?
Well, I think it's important to talk about the way this is affecting the wider healthcare workforce. The issue with the junior doctor contract particularly is that the contract is not fair, it's not safe. The proposals that are being made are not going to create a sustainable workforce for the future. And I think we're seeing those changes across healthcare, and I think it's deplorable.
Obviously, Hunt and the government are claiming that an agreement was close to being made prior to strike action being announced. 15 of the 16 issues have been agreed. So how far are we really from coming to an agreement? So what's been agreed so far, and what's the key things that are left to agree?
Well, I think the really big issues, the first issue to address clearly is that Jeremy Hunt's talked about 15 out of 16 issues. I just want to be clear that that's a completely made up figure. I have no idea where that's come from, because in reality there is a clear gulf between us and the government. That's why we've ended up in the situation we are now. That's why we're heading towards industrial action. Because at the end of the day, we have a contract proposal that is in front of us now that remains unsafe and unfair, not just for doctors, but for patients.
That brings me on to my next question, which obviously it's a debate between the most and least trusted professions. However, the government are very good at media spin, painting doctors as the bad ones and causing patient harm by striking. What argument would you put to the public to support junior doctors?
Well, I think the most important thing for people to remember is that this is a fight we're taking up because of them as well as because of ourselves. I think that it's really important to remember that at the end of the I think it's really important to remember that on the issue of this contract, we're actually trying to fight for a system that's safer for all of us. I think really importantly as well, industrial action isn't something we've taken since the 1970s. It's not something that we take readily, it's not something we want, it's something we are being forced to consider, something we are being forced to take because of the position we're being put in.
Is there anything that could happen between now and Tuesday that would call the strikes off?
Well, I think at this point, sadly, the government just hasn't moved enough. And I think the trouble we have is their proposals remain unsafe, they remain unfair, they remain untenable for a working contract. And because of that, we're forced to be in a position where we cannot continue to accept that. And that means we are forced to take the industrial action that we have.
As a doctor, in the NHS at the moment, how would you have gone about addressing the 16% rise in deaths at the weekend? And obviously the government should be spending a lot more time listening to the workforce and how they could address the issue.
Well, I think firstly, it's important to say that I don't think there's anything clearer than a 98% mandate. I think it's very clear that almost the entirety of the doctors in our profession have said that this contract is unacceptable. I think they need to start listening to us and listening to the BMA and coming back to the table with real proposals, because actually the message has been very clear.
With all of the misinformation around at the moment, are there any commentators, such as the Bruce Keogh or Clive Beadle, that have been very active in their sort of commentary that are sort of good to listen to? Are they reputable, or are they biased?
I think it would be very difficult for me to comment on other people in important positions. However, what I will say is that I would encourage people to read the briefing documents on the BMA website. I would encourage people to watch the videos on the BMA YouTube channel, because actually what we've tried to be very clear about, and I'm pleased that we've been able to come out and be clear about now, is exactly where we stand on the issues and the ways in which we're trying to represent the views and the rights of our members. And I think that's very clear that we're not just protecting them, we're trying to protect patients.
Back in November thought that there should have been a complete pause in negotiations and that a debate should have been had. Is it still too late?
Well, I mean, the difficulty we have is that the threat of imposition remains from the government, and that's certainly unacceptable. I think the difficulty we have is we need to try and take every opportunity to talk. That's something that we continue to do. You know, we continue to be committed to negotiations. It's why we agreed to go back in ACAS. It's why we delayed, or we stopped the industrial action when they were first announced, because we were committed to finding a solution. I think the trouble that we have is clearly the Secretary of State, Department of Health and NHS employers don't share that commitment.
Now obviously the RUMS Medical School Association and UCLMS have given students advice on how they can get involved while spending time near strike sites. Obviously we're not allowed to go up to picket lines. But how would you suggest students get involved who can't attend?
Well, I think the really important thing that people can do is they can communicate with their MPs. I think it's so important that they write to them, they communicate with them, and they express their concern, because the difficulty is this isn't just a contract for now, it's a contract for a whole generation to come. And I think it's so important that they start writing to their MPs and making clear to them how they feel about the issue. I think it's so important that people like their families are involved in that discussion, because I think everyone that you speak to widens the debate beyond our medical school bubbles, if you like, where it's so easy for us to be in this vacuum. So I think it's so important that we start to reach out in that way, reach out to newspapers, write into, Comment is Free and all the other fantastic places where we can get opinion pieces published to really try and convey, I think, the unique struggle of medical students in that they are already in a £9,000 a year degree that will leave them with something like 70 grand of debt at the end, and a career which is dramatically changing them, and actually probably isn't sustainable, particularly in London.
Very true indeed. As London waiting was one of the issues that was talked about. Has the government given any sort of clue on whether they're going to manoeuvre on that?
Sadly, it remains one of the many issues in which the government have not mapped, and they have not been clear where they stand.
But a recent student room poll revealed that a third of less students who wanted to initially study medicine no longer want to because of the junior doctor scandal. What do you think the profession can do, and the government to reassure young people that medicine is still a viable option?
Well, I think it's very clear that the contract has had such a negative impact on our recruitment system. I think it's so important that the government come back with real changes to their current offer, because I think if they don't, we do not have a workforce in the next, immediate few years.
And sort of lastly, what happens after the strike action, and what's next for talks and negotiations?
I think we continue with talks, but I hope that all of this action will really start to see a change in the government's current offer, to see a change in their attitude to negotiations.